Welcome to our video series titled Preparing Caregivers with Knowledge, Ability, and the Power to Act. This series is sponsored by the Learning Institute for Global Hospice Training, LIGHT, and is available on our YouTube channel, Hospice TV. This is all made possible by a partnership between Hospice Foundation for Outreach and Washington University Division of Palliative Medicine.
Hello, I'm Debbie Oliver, a professor at Washington University and a former hospice caregiver. I have cared for my husband and for my mom.
Welcome to our video on how to help your loved one with respiratory changes at the end of life and how to help yourself cope with the uncomfortable sounds they are making.
I'd like to share some tips that I learned while caregiving for my mom and my husband during their final days. There are 3 different kinds of sounds that you may hear as your loved one's breathing changes in the final days or hours. They will usually have only one of these 3 sounds. The sounds change quickly and may be quite loud. First, you may hear a gurgling sound, known as noisy breathing, or sometimes as the death rattle. It sounds like someone drinking through a straw with an empty cup. Air is passing through secretions, making noise. An alternative may be a gasping sound. It's similar to sleep apnea, where the patient will stop breathing for a short time and then suddenly gasp for air. This is called Cheyne-Stokes breathing. Finally, you may hear a moaning sound. This is often mistaken for pain. It is loud, like snoring, and is thought to bother only those who must listen to it, not the patient. This is called agonal breathing. Now that we know what to expect, let's talk about what we can do about those changes. There are some medications that we can talk about. In particular, your hospice nurse may suggest morphine, a patch called scopolamine, or a liquid medicine called atropine. Hospice nurses sometimes suggest liquid morphine. If you have already been giving this, they may increase the amount and the frequency, perhaps even as much as once per hour. The morphine may slow the respirations and ease the air hunger. This highly concentrated drug can be absorbed in the mouth and does not have to be swallowed. By slowing the respirations and easing the air hunger, you are not facilitating an earlier death. You are providing comfort.
The hospice team may also suggest some medicine to try and lessen the secretions. While they do not always work, there are no downsides to trying them. There is a patch, scopolamine, that can be used behind the ear, which sometimes eases the secretions. Sometimes they recommend a few drops of a medication found in eye drops called atropine. There are also some simple ways that don't involve medicine which can help. First, rather than lay on their back, if we position the patient on their side, it allows those secretions to exit and not build up as badly. Pillows can be helpful and not only help support the positioning, but make them more comfortable. Second, when the body has too many fluids, as the body slows down, the secretions can increase. It is helpful then not to force fluids so they do not get overloaded. Third, speak calmly to your loved one, wipe their mouth, and don't panic. If you are calm, they will stay calm.
A special note on something that is not recommended. Some families ask questions about suctioning to remove the secretions. Experts agree that suctioning can be distressful for both the patient and for you. Also, suctioning can actually stimulate secretions and make the problem worse. Experts advise against trying to deep suction hospice patients.
Now we turn to ways to help you cope during this difficult time. First, take turns sitting by the bedside. Allow other family members and friends to take shifts so you can step out and get rest. Short shifts, an hour or less at the bedside, then an hour outside the room, can be a helpful relief. Next, try playing soft music or background noise to distract your mind from the uncomfortable noises. We believe patients are able to hear what is going on around them, and soft music or background noise will be comforting for them as well. If this is not possible, earplugs or headphones can help you. Finally, call your hospice nurse with questions or concerns. Hospice nurses understand what is happening and often have many solutions they can share. While the nurse may not be able to sit beside you through this difficult time, they are available to listen to your concerns and visit if necessary.
Being with your loved one during these final hours is a gift of love. Holding their hands, wiping and cleaning their mouth, positioning them so they are comfortable, speaking calmly, and providing a soothing environment are some of the final gifts of love you have to offer. Do not hesitate to say what's on your heart. Thank them for the gifts they gave you and assure them that they are not alone. These final words can be comforting to you both. Thank you for listening, and we hope this information will help you understand, know what to do, and know how to cope with breathing changes in your loved one at the end of life.